Good morning, everybody. I'm Dr. Saurabh Bansal, Senior Consultant, General Laparoscopic and Minimal Access Surgery from Yatharth Hospital, Greater Noida and Noida. Today we're going to speak about colorectal cancers. I choose this topic because the incidence and the prevalence of colorectal cancers, that is large intestine cancers, is increasing in India from the last 2 decades and in the Asian countries. So if we talk about the incidences, actual incidences of the cancer incidence, there are almost 2 to 3 cases newly detected in our country as per in the 2018 data per million population every year, which means a huge number, which was very less before 2 decades. If this cancer of the large intestine was more prevalent in the Western countries like USA and Europe, but it is now seen in higher surge in the Asian countries also, like Thailand, Singapore, Korea and Japan. Now if we talk about patient comes and usually they tell, so why this has happened to us, what are the reasons why this kind of cancer is happening to us. So generally this cancer is usually related to the age also, with the increased age and the genetic changes happening. It is more seen in the older age. And secondly, the most important factor is the diet. The high fat diet along with high consumption of alcohol along with smoking are the most important factors which lead to the, which are leading to the most of the colonic cancers recently seen. Highly processed foods, the red meat, the high consumption of the dairy and cheese products are also associated with the high incidences of colorectal cancers, along with the very lazy lifestyle of the people. So usually now the patients usually come to our clinics or our hospitals with the most common symptom is that alteration in the bowel habits, which I mean is that sometimes they will pass a very loose stool or sometimes they may pass a very tight stool. So usually this kind of symptoms are generally mistaken by the most of our clinicians as a gastrointestinal infection or something which is very prevalent in Indian subcontinent. So they need to be properly examined, and these symptoms should never be ignored, especially in the old age people. The other symptoms which are common with these patients are like bloody diarrhea or blood in the stools or mucus in the stools, or and the other thing is they may come with a complaint of swelling in the abdomen later on when the disease get progressed. The other symptoms which are really common, patients come and tell that they have lost a significant weight, they don't feel hungry at all, they feel very weak because they lose their blood in the stools, which they don't realize eventually, and they realize when we do some blood investigations and all. So usually when the patients come to our clinic and we diagnose them with few blood investigations, and we in all the suspected cases, when we do our clinical examination and rectal examination, we advise you to get first thing is to get an colonoscopy done. So if we found any kind of suspected lesion or on the colonoscopy, or suspected there is a growth or a mass, we do a biopsy at the same time, and then after that we do a CT abdomen or the other investigations like MRI if the cancer is lower down, according to the site of the lesion and according to the requirement of the disease also. So the next question comes is the most scary part, that whether the cancer is curable or not. It is absolutely curable cancer. This is one of the most common cancers which has very good prognosis among the other gastrointestinal cancers in the body. So surgery remains the mainstay of the treatment, but it is involving other fields also, like it is a multidisciplinary approach. You usually require a chemotherapy also or a radiotherapy, depending upon the site of the cancer or depending upon the stage of the disease. So usually a group of surgeon and a cancer specialist itself, we decide among ourselves that what will be the best treatment for you to further treat your disease. So now coming to the mainstay like surgery, when we talk as a surgeon, I will talk more about surgery. So When we talk about surgery, there are more advanced surgery now within the last 2-3 decades, which has developed with the advancement of science and technology, that initially it was done through the traditional method through open surgery. It is still being done in the most part of the world, and now we have started in last couple of decades we have started doing more of minimal access approach, which is called as a laparoscopic surgery or a robotic surgery. So the advantage of laparoscopic or a robotic surgery is that it gives you a very early recovery. It is a more pain-free. The morbidity of the surgery is very less, and you hardly have any cut on your body. So your recovery becomes very fast with that kind of approach of the surgery. Now after surgery, generally patients usually require a chemotherapy depending upon the stage of the disease. Now the question, most common question everybody coming in the clinic will ask that, sir, whether I will get all right, whether this disease will be getting completely cured or not. See, the disease, the cure depends upon the stage of the disease. As I said earlier, the prognosis, the outcome of the disease is very good if we treat it early, if we diagnose it early, and if we manage it properly. Right. So usually in the earlier stages, like stage 2, 1, 2, 3, the prognosis of this kind of intestine cancer is really very good. And there are a lot of things which has newly come up which take care of a lot of other, if the cancer has spread to other parts of body also. Now it is really important that the message is that it is really important that you don't ignore your symptoms. The best part is that you take your symptoms sincerely. If they are happening you for a long time, go visit your nearest doctors or a clinician or a physician or a surgeon, so he or she can help you out with your diagnosis, earlier diagnosis and proper management of the disease, so you have a better life when you diagnosed earlier. Then the last thing I want to stress upon is that patients do ask about the quality of the life, like they had a cancer, now what will be our quality of life, whether I will be able to work or not, whether I will be able to do my routine activities or not. See, it is a total course of almost 6 to 8 months of treatment if you are diagnosed in a properly stage and all. And after that, I have seen, we have experienced, and many of the centers have experienced, that the quality of the life of the patient is absolutely close to normal or normal when diagnosed early and managed properly, and they are living an absolutely normal life. So I wish you, the carry home message is that please don't ignore your symptoms, visit your doctors, and if you like to visit me, you can very well book my appointment on the website, that's lLybrate.com. Thank you so much.